Hello, everyone. My name is Conic. I am a member of AAPM&R's Content Creator Workgroup and a current Pain Fellow at the Mayo Clinic in Jacksonville. Today I'm excited to speak with Dr. Shahpar again about the Cancer Rehab Special Day.
Hi, I'm Dr. Sam Shahpar. I've been a member of the Cancer Rehabilitation Medicine interest group. It's changed throughout the years, but for many, many years since it established. I've been in various leadership components of that throughout the time, and we were really excited to see it grow. I'm at the Shirley Ryan Ability Lab. I've been practicing cancer rehabilitation primarily in the inpatient rehab end as well as outpatient with a mix of some clinical research, and really excited of these advanced clinical focus days moving ahead to kind of push our academy meetings forward in terms of the content, the information. I think really from where we started, even 5 years ago, the content and information's really progressed forward, and we're getting higher level information that no matter where they are on the spectrum of training, whether it's just starting or a decade plus out, you're still going to get valuable information during this meeting time.
Yeah, that sounds so exciting, and I'm super excited about the upcoming meeting. But tell me, how did you end up choosing PM&R and cancer rehab?
So I didn't really know anything about medicine when I started. I really came into medicine because I wanted to help people, and I was actually interested in pediatrics. And I worked at a pediatric hospital in undergraduate, and then indirectly I got connected to some pediatricians that were doing cerebral palsy, and they told me to go to the Rehabilitation Hospital in New Jersey. It was called Children's Specialized. That's where I ran into actually Chris Visco, who's been active in our leadership around the country. He was a resident at that time. He taught me a bunch of things, and I got really excited, decided to learn more. Interesting enough, when I was volunteering and working at the Children's Hospital, I was working with a lot of cancer patients, not that being a plan of what I go into. And then as I got more and more experience, I found that cancer rehabilitation was something that at that time, although we were doing as a specialty, was not quite focused on. We had other specialties like spinal cord and brain injury, amputee, but cancer rehab was just kind of mixed into everything else. But as the field evolved, I found that that was my interest. That was something I wanted to kind of push forward and really kind of work with our specialty to develop this expertise. I think me personally, and unfortunately most people that I know, have been affected by cancer, whether on a family basis, someone they know, someone they work with. And so it wasn't something that was out of reach. Everyone understood of how cancer can affect the day-to-day lives. And I think why I became a physician, why I went to physiatry, why I go into cancer rehabilitation is that specific thing. We know something that affects all of us, and how can we push that forward to really help everyone's day-to-day life?
Yeah, that sounds on par. Even though I'm a pain fellow, I have an interest in cancer pain as well. So could you tell me a little bit about the Cancer Rehab Advanced Clinical Focus Day sessions and kind of how you planned them?
So for the Advanced Clinical Focus Day, I know this is a newer concept for our community. And I think luckily we have somewhat of a close-knit community, and between the groups of different leadership of different areas, we've gotten a lot of feedback throughout the years of topics that we want to push forward, that we need to have more interest about. And I think talking to varying leaders in different areas of our group, we came up with a few ideas, and some of them are a mix. But one of the key components is medicine in general is becoming very individualized and focused. And one of the ways cancer care is changing by more directed therapy, and we know about immunotherapy. And so we decided to have some focus on immunotherapy, and a component of that is the CAR T cell therapy, which is chimeric antigen receptor T cell therapy. These two aspects are really the newest research of all the different cancers that people are trying to leverage that into cancer care. What we need to do as physiatrists is really understand how that's going to affect patients within context of their prior treatment and moving forward. And we want to be part of the process as these new treatments are coming out versus down the road once we see all the side effects and the complications and then they come to physiatry. And so really getting our knowledge up to par of all the active pieces that are going on, it's going to be important for us to be partners with our referring sources, our communities, our patients, our family members. That's what's going on, to see how we can optimize and help and be involved in research, right? A lot of this research is going on, really assessing patient functional quality of life, pain within those aspects, but it really starts with understanding that. The last piece of our advanced clinical focus day is really focused on, we've used a few different terms, and we all kind of are commonplace known of burnout. Burnout is a big discussion within our community, not just physiatry, but the physician group as a whole. And I think within cancer rehab, we've talked a lot about that because there's some unique aspects, not saying other specialists within our groups of physiatrists don't deal with, but the mortality, morbidity, terminality of disease, people from young ages, from pediatrics, adolescents to young adults, to our peers, to our family members, that we can have a little bit different bias. Some of us may know people who've had a traumatic brain injury or spinal cord injury, but like we mentioned, everyone knows someone with cancer. So even if the disease is not as terminal, it may affect us emotionally because some of us are patients that are dealing with cancer as well. And so I think we deal with a lot of those challenges that are coming along. So we felt a good session that may not just be about data and medical facts and the newest research, but to really talk about how different levels of our practice, how we can help each other, and how do we manage ourselves to continue to grow as individuals and maintain our sanity at that same time.
That is so important, so important. Do you have a specific session that you would recommend that somebody attend who is a beginner in the cancer rehab realm, whether it's a medical student or a resident who may be interested?
I think I'll be biased, and I do think all the cancer sessions that are going on, not just at the Advanced Clinical Focus Day, but throughout the planned conference in Salt Lake, is going to be important. I think generally, in my experience, our approach to cancer care is to bring it down, the language that we use, to somewhat of a patient level, not saying the information we have. So it's not a knowledge of patient level, it's the language. So even if you're just starting out, I think the information we share, the community we have, is approachable at all levels. And so there may be things that even people starting their career may be feeling like they're over their head, but I think the approach to understanding and being able to say, I can get this and I can get there within time, and the supports that we have in are great. The other aspect that happens in a lot of these talks and sessions are the networking that's involved. I feel like most of the speakers, I don't want to speak for them, but this is just based off experience, are really helpful during the session, after the session, before the session, and interaction, getting to know. And so whether someone's interested in research, getting more clinical time, being a mentor, or getting a mentor, whether it's through email or otherwise, being involved in the group is really the best opportunity to be able to build kind of what you need to know and whether you think this is for you or not. And so I think that's how I worked. I had mentors and I just showed up. And when you show up, they're going to guide you along, because I think all of us, especially in a growing field of cancer rehab, we need more people. And so we're not worried about a turf war of other physiatrists coming in. We're worried about getting more and more. So we want more and more people, because the broader the spectrum we have of cancer rehabs throughout the country, the more accepted it's going to be, the better data we're going to have, the better outcomes we're going to have. So we're going to accept everyone no matter where you are. And I think all the sessions are going to be helpful to be able to move you forward, or at least understanding where you need to go to be successful in your practice.
Great. I think that that's so important because, as you mentioned, those patients could be interspersed in your general day, or they could be, specifically, you could have a cancer rehab service. So it's great. I look forward to potentially meeting some mentors, at least in the field. Is there anything that you're particularly looking forward to at the assembly this year?
Well, I've never been to Utah. So
No?
Utah will be a brand new experience for me. I have heard many good things about Salt Lake. One of my former co-residents has been out actually in Salt Lake for a period of time. She's been trying to get me to go. So this is a good time to have that experience. And so I think that's one of the great things, although we have our meeting every year, sometimes in places we've been before, which is new and it's nice to be familiar. But as we go to new places, as the group, you get to explore and see different local aspects to it, in addition to the experience of the conference itself of meeting different people. And I do think when it's in different locations of the country, it opens the door up for some people that wouldn't come on the East Coast or certain end. It creates some accessibility that you have other members of the academic and private community of physiatrists to be able to show up, and you get to learn from different people of how different people practice throughout the country.
Yeah, so true. So speaking of that, do you have any fun pre or post conference plans sticking around in Salt Lake?
So interesting enough, there is one. I think some of the cancer rehab physiatrists have been mentioning. I believe there's a game, NBA game in Salt Lake City, I think the Wednesday before the conference. So I think there's some people that said if people are flying in on Wednesday evening to potentially go and catch a game through there. So that would be some of a new experience, a new stadium, a new community to end up seeing. And I think most of us talking to, especially my former co-resident who's out there, is hopefully getting outside at some period of time to see kind of the views. I don't know, depends on how I'm feeling for the hike, but at least to get outside and do a little walking.
Yeah, I'm not sure what the weather component, but considering that our annual party, which I hope to see you at, is outdoors, hopefully the weather's still nice. So speaking of which, what is going to be your Halloween costume this year?
Interesting enough, was just having a discussion with my partner recently about some of that. There are some debates of what to do, but I think what I'm leaning towards, I have an older costume I haven't used yet, but it is just a pickle. I'm gonna potentially I enjoy pickles, and it's a simple costume, but it's something that I think a few people have seen me in it. It's enough to bring a smile to people. So anytime a costume can bring a smile, even if it's at me, not with me, I think those are the best costumes.
We do. Well, thank you so much for joining me today. And I hope everyone comes and checks out some of these cancer-focused sessions as well.
I appreciate your time. Thanks for talking with me tonight, too.